So I'm not a martyr.
So what's going on? Apparently you want to talk about Mary Lou Retton.
Yes.
And not about her plugging Colonial Life Insurance or Colonial Penn Life Insurance.
Well, I think that's probably somewhat ironic considering what is happening with her right now.
It's weird because you know what? I saw her for the first time, I want to say a week ago on an ad on TV. And I thought to myself, God, she looks really bad. Like I wouldn't necessarily be wanting to cast her in a commercial anyway. But so it's just interesting that now you're saying she's news. You're so right, Double K.
So on foot. Yeah, I'm just.
You should see it. Yeah. Go ahead. Talk about Mary Lou.
Whatever. So Mary Lou Retton, unfortunately, is in intensive care right now and is not doing well. And the reason we're talking about this is because apparently she has no health insurance.
Do we know what what's her diagnosis? Like, what's wrong with her?
They haven't really revealed too much, regarding what that's all about. All they're saying is that she's not doing well and that she doesn't have any way to pay for her medical treatments. And lo and behold, that is the problem. Not that she can't pay for them. It's that the system's broken and we don't have a universal healthcare system where if we did, this wouldn't even be a story. But it is a story because this is one of the greatest gymnasts who ever lived, won the gold medal at the 1984 Olympics in Los Angeles, has been a national hero in many respects for a long time, had a great appearance in Scrooge, I might add. This is a lady who in many ways is just sort of emblematic of the system in terms of how it is broken. Her days of glory are long gone. She's only 55, but she might as well be 85. She doesn't necessarily have a lot of time left. And for her family's sake, they're going to go.
Wait, how old did you say Mary Lou Retton was?
55.
Oh, okay.
And this is bankrupting her family as a result.
She's only 3 years older than me. Jesus.
So, now
the moral of the story, man, hardcore sports is not good for your body. Woo!
Yeah. So Carla Harrington, friend of the show, says it's a rare form of pneumonia, which is terrible.
That is
terrible. Again, we're not wishing any ill on Mary Lou Retton.
Oh God, no.
It's horrible. What we're acknowledging is that we have a broken health system. It's not health care. So I really wish people would stop calling it.
Yeah, we don't have that.
We have a for-profit health system. That's what we have. And so unfortunately for Mary Lou, this is just another statistic in the system that goes unnoticed. She just happens to be a very well-known individual.
Which maybe brings attention to the issue. I mean, that's ultimately what you can hope for when it happens to someone that's noted.
Oh, absolutely. And so for her sake, we want to hope, we obviously would love to see her recover, but the fact that the family's put out a statement that she's in intensive care is obviously not a good sign. At the same time,
people recover from being in intensive care. A lot of people are in intensive care and then get out of intensive care.
Well, a rare form of pneumonia is obviously very bad.
Yes, it's serious, but you're equating this with a hospice situation.
No, I didn't say that.
All right, you sounded very dire. And yes,
dire.
Intensive care is very serious.
But the fact that they allowed it to be leaked to the media tells me that it's obviously not good, and so is it not good. And as a result of it not being good, we can really shine a light on the fact that she does deserve to be taken care of. And apparently, and this is my opinion, I could be wrong, but the reason they leaked it to the media, especially in her dire time of need, is because they can't afford to help her. And now they want to put it out there to the public and say, help Mary Lou Retton because she may be dying and she can't afford to live. What about the tens, if not hundreds of thousands of other people who are suffering just like she is, who can't afford to live? Because that's what this is all about. Can't afford to live. But, we have plenty of money for war. Yeah. We have plenty of money for tax cuts. We have plenty of money for the parliamentarian.
The parliamentarian. I wonder what the parliamentarian makes for a living.
Pretty handsomely compensated.
You think? We're going to have to look up the salary. If anybody ever has a chance, look up the salary of the congressional parliamentarian. I am curious. I mean, because I bet you she's not anywhere near as good as the League of Women Voters Florida parliamentarian. That chick is on it. Mm. That's how I really learned what a parliamentarian is supposed to do. I'd never seen one actually work before.
Parliamentarian is paid $203,000 a year. That's pretty good money to tell the American people to go get effed.
Right. It's a pretty good amount of money to say, no, you may not have a living wage. The irony of that.
Or you may not have health care. We can't afford it.
We just can't afford it. Sorry.
but we can certainly afford a lot of other things.
Have you seen the budget? We can't.
Yeah.
Sorry, we can't.
Trillions of dollars. I mean, we can't afford to save money on healthcare. We just cannot afford that.
No, we can't afford that.
So this is where we are. We need a universal healthcare system.
This is, if this is not so symbolic of the broken system, it's sort of like how I think, as much as I am not a fan of Trump's, I do recognize that ironically, he is absolutely the most, he is the best representation of our image in the world. That is how I believe the world sees the United States. So I do think he's good. But how sick is it, literally, that somebody who is a champion of sports that was on the Wheaties box that we put up as like a champion of America, and yet somehow she's not worthy of healthcare? I find that, like, it's very telling. So we liked her when she won a gold medal and we were put her on the Wheaties box, but now that she doesn't have health care, screw her. Screw her. She didn't. I mean,
you don't like
really?
my music. That number's not even that accurate. In fact, that's beyond a conservative estimate.
That's very conservative.
I mean, obviously it's Yale that's saying it, but all statistical data points to a universal single payer system saving $500 billion a year. And that's getting everybody covered with the basic necessities of healthcare. So to suggest otherwise, that there is any other option, there is none. And if you're running for office,
that's why I don't even debate this anymore. This is why I don't debate people, because they want to debate things that are not debatable. I'm not going to debate Medicare for all any more than I'm going to debate a flat earther or a creationist or anyone like that. I just don't. Where certain things are just done. Right. It's done.
Universal health care now.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.